Assalamualaikum and welcome back to our discussion, and our topic today is still autism. How can parents determine if a child with autism is ready for preschool?
When you talk about education, is the right of every child. So what are some of the factors to consider? First thing, see whether your child is able to engage in play with other children. Number one. Are they able to share the toys or participate in group activities? Can your child dress, feed, use the bathroom independently? A tick to all of it? Good to go. We have a taska for OKU. So I would say it's better for the parents to prepare the children in these areas which I have just mentioned, and then consider putting them into the proper preschool.
What types of preschools are best suited for children with autism?
Going for assessments, going for diagnosis is very important, because that will be a deciding factor for parents to identify the proper setting for the child, because the goal should be on the child to succeed academically. On a general basis, when we are looking at the point of view and the reviews from educators, they have children who are not appropriately placed in their centers. The child will be academically challenged, maladaptive behavior, susah nak sesuaikan diri, and then you blame the child, and then you can see them become less and less positive in terms of their attitudes, especially towards learning.
What are the benefits of enrolling children with autism in preschool?
Number one, behavioral shaping. A school is a setting where a lot of behaviors are being picked up. Even typical children, they pick up a lot of behaviors. So when you have trained teachers in the early childhood field, they have the expertise, they have the skills of how to promote positive behavior and elicit desired behavior. Preschool provides an early opportunity for children with autism specifically to receive specialized support and early intervention. In many cases, I think Teacher Farah, you will agree with me, it's always the teachers who actually first realize there's something wrong with the child. It's not even the parents. Sometimes they know, but they tend to actually close one eye, or they just keep quiet. When the teachers are actually telling, I think there's something not right, or your child may need help, that's when they will say like, yuck, you know, actually I think they know, but yeah, like, yuck. Yeah. So where is this specialized support coming from? It is because the teachers are noticing there's something not right somewhere, and they try their level best to give the early interventions. Thirdly, the benefit of having your child being placed in a structured environment. Those who are in the preschool, you know, you have the structured settings for everything, being for play, for learning, for eating, everything. So you know that ASD children, they like structured settings, they love routines. So it provides the child to learn and practice essential skills such as self-care, academic skills, social skills within that settings, you see, which probably a house, a family situation may not be able to provide as much as a preschool would do.
How can social skills be developed through preschool activities?
Peer socialization. You create an environment, you create activities, learning settings where a child can work together on art projects, building structures. All these are related to the syllabus as well, I guess. Playing cooperative games where you can actually encourage teamwork, sharing, problem solving. You also can actually develop social skills through board games, card games, sharing toys. Teach the children the importance of waiting for turn taking, respect others' belongings. See, so these are the basic things that's already there. You just need to like intensify the frequency of having these activities being done on a group setting, and that helps develop the social skills way better.
How can preschools actually support the unique needs of children with autism?
So in special education, there is a term that we call differentiated instructions, or in Malay we call pengajaran terbeza. For example, If you have a child that is slow in reading, this is very common in any preschools, okay? We know that that will interfere with their comprehension. So how do I do the modification? You shorten the reading activities, but on a repetitive basis. Shorten it, repeat, and then go to the next part, and then you repeat and repeat. You also need to, as I said, reduce the copying and writing, or even pointing at a cue picture. For ASD children, they need a lot of visual cues. Yeah, answer according to the pictures.
Alright, thank you so much, Dr. Grace, for today's session. Till we see you on our last episode next week. Assalamualaikum.